Hello, I am Dr. William Katibah, and I want to thank you for taking the time to watch this presentation about my new medical practice. I have two goals for this presentation. First, I want to explain the problems with the current American healthcare system, and second, I will offer a solution for many of these problems. By the end of this presentation, you will have a plan to provide for the healthcare needs of both you and your family, and you will realize that this plan is brilliant in its simplicity and yet very affordable. Do you ever feel like this whenever it is that time of year to choose the medical insurance plan that you will be forced into for the coming year? We dread this time of year because we know we will be getting that annual sticker shock, since our medical insurance premiums go up 15 to 33% every year. That sticker shock is not just your imagination. You are now purchasing the most expensive healthcare in the entire world. This graph shows how rapidly the cost of an American citizen's healthcare costs have risen over the last 30 years. We pay twice as much as citizens in other developed countries. Finally, when you pick a plan, at least you know you are paying for the best healthcare. Well, think again. Paying the most for our healthcare does not guarantee that we enjoy the best healthcare. If we looked at life expectancy as a measure of effective healthcare, we Americans rank 40th. Yes, I said 40 of all the developed countries in the world. Most of you have insurance provided by your employer, but how much does it cost you? This graph shows that in 2002, the average employee paid $58.66 for their portion of their medical insurance, but by 2012, the employee's premium had doubled to over $11,000. This is no surprise to any of you, but to put this increase into perspective, this increase in your insurance premiums is almost 4 times the rate of inflation, which was only 28% for the same 10-year period. More bad news is not only has your insurance premium doubled, but your employer has been forced to increase your deductible, the amount you pay before your expensive insurance even begins to kick in. Many of my patients are being forced to pay $4,000 to $6,000 before their insurance starts to work. So, you can see the current healthcare system is expensive for employees, for employers, and for those who are self-insured. But you may not realize that it is also very expensive for another group. 40% of a family physician's operating costs can be directly attributed to insurance. To look at it another way, it costs the average physician almost $83,000 each year to deal with insurance. First, he has to pay for additional staff like certified coders and billing specialists. And then there's the computer software, which is required in order to file the insurance. And often we have to refile the insurance claims. And then there's the hassle of documenting what the insurance agrees to pay, and then writing off the leftover amount. All of these issues occur out of sight of the patient, but they add to your eventual healthcare costs. So as you can see, we all feel the pain. Patients feel like cattle being pushed through the system. When you leave the office, do you feel you have had your concerns addressed, or are you just handed a checkout form filled out with the correct diagnosis codes so the doctor can file the insurance claim? We doctors aren't feeling very well either. Most of us want to help you maximize your health, but we don't have the time to discuss with you how to be healthy. That is because in this system, we don't really work for you. We work for the hospitals who own us and the insurance companies who reimburse us. Did you know that hospitals are buying up all the physicians so that we will refer our patients to that hospital for the labs and x-rays that you need, so that we can refer you to the specialists that work for that hospital, and so that we will send you to only that hospital if you need emergency or inpatient care? We get dinged by the hospital if we refer you to a different specialist or hospital, even if it is the best choice for you. Did you know that the hospital system that I used to work for wanted me to see 31 patients every day? That doesn't leave a lot of time to spend with each patient. One national study found that the average doctor only spends 7 to 10 minutes of face-to-face time with the patient. If we try to spend more time with each patient, we fall behind on the schedule. This causes long wait times for the patients by the end of the morning or the afternoon. So how do we fix the healthcare problem? Obviously, we need to find a superior model, but we will have to think out of the box. Albert Einstein once said, the significant problems we have cannot be solved at the same level of thinking with which we created them. We cannot and we must not continue doing healthcare the same old way. It is just not working. Perhaps we should once again use healthcare insurance for its original purpose, to protect against a medical catastrophe. Let's use the analogy of automobile insurance. Many of you drive automobiles, and yet you understand that you have to keep gasoline and oil in the car, and to have to perform regular maintenance checks, but you would never expect your auto insurance company to pay for these services. You purchase auto insurance to protect you in case of a catastrophe, to pay for bodily injury, or to repair damage to the car. You don't expect your insurance to pay for your drive to work, or for your oil change, or other maintenance. And yet we expect our medical insurance to pay for every little service that we need from the doctor. No wonder your healthcare costs are going up. It is my strong conviction that we need to apply this same strategy to medical care. Guess what? This model already exists. This new model of medical care, which is sweeping the country, is called direct primary care. There are already several hundred such practices in 26 states. Let me first explain the origin of direct primary care. Who created it? We don't know, but the model is definitely not new. The ancient Chinese 2,000 years ago had an interesting way of paying for their medical care. They would pay their doctors at the end of the year if they had stayed healthy all year. The doctor was paid for keeping you healthy, not for treating you when you were ill. The first known direct primary care practice was started by two physicians in Seattle in 1966 and was called MD squared. The next year, 1997, one of the founding fathers of this movement named Dr. Garrison Bliss started Seattle Medical Associates. His model has grown to now involving 27 physicians at 5 different office locations in the Seattle area. I met Dr. Bliss at the first annual Direct Primary Care National Summit in St. Louis in October of 2013, and his passion for this model of caring for patients has inspired me to adopt this model. In 2007, the legislature in Washington State passed the Direct Primary Care Act, legalizing direct primary care offices. Direct primary care is specifically mentioned in the Affordable Care Act as a legal entity to provide health care in the healthcare exchanges. What makes direct primary care so unique? You see, you no longer need to ask if my office takes your insurance, because we don't. We will take care of you no matter what your insurance company says you do or do not need. Now I work for you and have your best interests in mind, not the interests of the insurance company. I know this concept sounds crazy, but that is because we have lived under the control of the insurance industry for so long that we don't realize there is another way. Again, I want to reflect on another quote from Albert Einstein. If at first the idea is not absurd, then there is no hope for it. What are the benefits of direct primary care for patients? Well, you get more face-to-face time with the doctor. When the doctor spends real time in partnership with patients, the doctor feels less distracted and confused, and patients will get better. Dr. Garrison Bliss said, many diseases can be cured not by the doctor, but by the patient. Next, we can focus on health and wellness and not just the control or treatment of disease. And finally, because of our decreased overhead, we can charge drastically lower prices, keeping them transparent and consistent, no matter who the patient is or what their insurance dictates. Direct primary care is also a doctor's dream. It removes the insurance overhead from the equation. Now I can see fewer patients and don't have to rush them through the office. Now I can be the physician that I dreamed of being. And now caring for you is our primary focus. Here is a comparison of the old model versus the new model of DPC. In the typical medical practice, you have to see at least 22 to 25 patients a day. But in direct primary care, most physicians see 11 to 16 patients a day. The face-to-face time with the doctor is only 10.5 minutes in the typical practice and can be 30 minutes at a direct primary care practice, or even 45 to 60 minutes for a complete physical. The average wait time is decreased from 21 to 24 minutes down to 2 to 5 minutes, because now we're on your schedule. And the average price per visit presently is $120 to $145, but in direct primary care practice, it's only $25 per visit. So how does this new direct primary care model work? Patients purchase their primary care from their physician, usually in the form of a monthly or annual membership fee. This membership covers almost all services provided in the office, including an annual complete physical exam. The result is now the physician is in effect employed by the patient, not by the hospitals or insurance companies. This membership allows the physician to provide a level of care which cannot be matched by the present insurance-driven system. The patient still needs insurance, but only for catastrophes such as surgery or life-threatening illness or injury. Using medical insurance only for its intended purpose often produces a drastic reduction in the price of one's health care. So I am proud to finally announce the name of my new practice, Direct Primary Care of the Carolinas. In case this address looks familiar, that is because it is familiar. My new office is located in the same building and office suite where we have been located most of the last 12 years. We were even able to obtain our old phone number, 704-547-9500, to make many of you feel like you are coming home. What kind of insurance strategies should you look into? I would suggest choosing a higher deductible option in order to lower your monthly insurance premium, and then use your savings from this deduction to pay for membership fees, or just enjoy the money that you've saved from using DPC. Research to see if your HSA, your HRA, or FSA can be used for your monthly or your annual membership fee. And there are also alternatives to traditional insurance. These three programs are not insurance companies, but they work by the members of each organization paying a very small premium each month, sometimes as low as $80 a month. And then the organization pools these resources to pay for the medical expenses of the members. These programs do not pay for routine medical visits or medications, but that can be a great way of providing your catastrophic insurance. So how does direct primary care of the Carolinas compare to the new Novant Health concierge practice? Interestingly, Hallmark Care by Novant Health opened November 18th with Dr. Teagland. But 3 other doctors will share a call with her at night, so her patients will have a 1 out of 4 chance of talking to her if they have a problem after hours. In the article, it quotes, "For longer appointments, 24/7 access, and more personalized care, patients will be asked to pay $2,400 a year in addition to having health insurance." Wow, longer appointments, 24/7 access, and more personalized care. That's what Direct Primary Care of the Carolinas is offering. And if I did my calculations right, $2,400 a year equals $200 a month. But the Direct Primary Care of the Carolinas only costs $59 a month. So come ride the new wave of healthcare, which is direct primary care. Let's you and me both get rid of those healthcare blues. I believe direct primary care can be part of the solution. And just because you may not have heard of it does not mean that it does not exist. As this quote from William Gibson explains, the future is already here. It is just unevenly distributed. Now I work for you, not for the hospital or the insurance company. I am sure you will find our membership will provide real value as well as peace of mind. If you want more information, please go to our website where you can read articles like these about direct primary care. Thank you for taking the time to watch this presentation, and we look forward to hearing from you at Direct Primary Care of the Carolinas.